I definitely tended to push the limits in terms of doing a ton of sports, tennis, basketball, and soccer. It didn't really start until I was 28 and I was coaching at that point, but I used to jump in all the time. So I would jump into the sessions and I remember feeling like I had tweaked my groin.
She had some hip dysplasia, which left her with some early arthritis. Now, of course, her activity level made that pain worse. So if she wasn't so active, she may not have noticed her pain so much.
As long as you can walk around and coach, you're okay. But then in the last year, I would say, it hurt to walk. He just said there's nothing else to do. It's one of the worst he's seen. It was just bone smashed on bone. There was no space.
We used to think of hip replacement and knee replacement as grandma's disease. And that's not true anymore. Now it's younger and younger patients. The average age of my patient is now in their young 50s.
Patients are much more active. They're getting arthritis in their hips at a younger age. I think that now we realize that if patients are really at that end stage disease and don't have the quality of life that they want, that doing a hip replacement on a young patient is a reasonable option.
I think that the implants have improved significantly. So they wear out less rapidly now with the newest, latest materials. Also, the technology, techniques, and equipment we have to redo them have improved so significantly that we're not nearly as afraid of redoing them as 40 years ago.
My patients are getting back to all the activities they were doing before, from simple things like going around the block and walking the dog, to more complicated things, such as running marathons, such as doing triathlons, and everything in between.
Like living my life again, right? I feel like I was always guarding it and only doing a very limited number of activities, and now I want to feel the freedom to do fun things and enjoy my life.